My name is Geoff Cumming, and I'm the chairman of INOVIQ Ltd. So this year has seen many of the objectives that we laid out this time last year and presented to you achieved. There's been pleasing progress in laying the foundations for commercial success in each of our two focus areas. We're satisfied that the organisational structure we have in place provides us with the platform from which commercial success can be attained. We remain focused on advancing the development and commercialisation of sub-B2N cancer detection and exosome isolation platforms. We've sought to validate our core technologies and establish a broad product cancer diagnostic pipeline with multiple partnering opportunities. These initiatives gained clinical validation of sub-B2M CA15-3 test for breast cancer detection and a commercial partnership for Promega Corporation in our exonet exosome capture technology. These milestones significantly de-risked INOVIQ's core technologies, drove early exonet revenues, advanced our sub-B2M diagnostics pipeline towards commercial viability, and expanded our future partnering opportunities. The sub-B2M technology was analytically and clinically validated by a contract research organisation based in the US called ResearchDx, and they were able to demonstrate that sub-B2M 15-3 test in combination accurately detected breast cancer and outperforms a leading approved CA15-3 test. So it's sub-B2M and 15-3 together has significantly improved the sensitivity and specificity of that test to 81% sensitivity, 93% sensitivity for the detection of breast cancer across all stages of breast cancer. And the existing test is better at the later stages, and it's important to be able to detect. The earlier you can detect a disease, the better the likely outcome. So the next steps for the sub-B2M CA15-3 test include a cross-sectional breast cancer monitoring study and securing a clear accredited laboratory in the US for commercialisation of the test as an LDT, a laboratory developed test, and that will occur through 2024. We conducted an extensive campaign to encourage leading academic and research institutions to evaluate the efficacy of exonet through the year for exosome isolation and biomarker discovery across potential applications in cancer, neurology, inflammation, and other conditions. Now, exosomes are considered to be a hot area in diagnostics. We believe that we have a tool that allows faster, purer preparation of exosome samples and an ability to develop a high throughput application. Key data were presented at the ICEV meeting in May 23 that demonstrated the effectiveness of the exonet technology in the isolation of exosomes from plasma, urine, saliva, and cell-conditioned media. Additionally, INOVIQ developed, as I mentioned, the high-throughput exonet isolation system in collaboration with a significantly sized US-based organisation called Promega. And that process can allow 200,000 samples to be extracted over a 12-month period. Now, that's extraordinary. At the moment, it's sort of one by one. The ability to be able to do 200,000 takes us into a new realm and ensures that larger development companies are starting to pay attention to what we have. That association with Promega led to the signing of a global joint marketing agreement that offers world-class solutions for manual and high-throughput exosome isolation and nucleic acid extraction to researchers and industry for exosome-based biomarker discovery and diagnostics. That market is of the order 8.7 billion or forecast to be of the order 8.7 billion by 2029, and that sort of reflects the fact that it is a hot area in diagnostics. Collaboration with the University of Queensland has paved the way for the development of an innovative exosome-based ovarian cancer test, utilising again ExoNet. Studies confirm the utility of ExoNet for fast and efficient exosome isolation and biomarker discovery, and the promise of ExoOC, OC ovarian cancer, as a highly sensitive and specific test for early detection of ovarian cancer. And of course, you'd probably be aware that ovarian cancer is often detected late because it's not obvious, it's not there for all to see, and oftentimes by the time it is diagnosed, it's too late for appropriate treatment. And with all cancers, the earlier it's detected, the broader the range of treatments that are available and the better the likely outcome. The next steps for ExoOC are to undertake further development and validation studies in suitable samples. During the year, INOVIQ continued to expand its R&D and executive teams with several key appointments to accelerate its product development, commercialisation and corporate strategies. This included expanding its R&D team with cell therapy and exosome-based therapeutic scientists, and appointed Mark Edwards as Chief Financial Officer and Company Secretary. Mark brings significant biotechnology, M&A and corporate experience, and I must say from a board perspective, he has been a welcome addition. Legal proceedings through the course of the year, the Walker and Erminger legal proceedings were resolved, and this marked a significant milestone for the company. The settlement, devoid of any admission of liability, preserves our future interests by securing a royalty over potential sales of the BARD1 lung cancer test and rights to utilise the intellectual property in other cancer types. As part of the settlement, BARD1 AG is required to invest $300,000 in further research on the lung cancer test. The company reported a net loss after income tax for the year of $8.97 million, a substantial improvement on the losses recorded in the 2 prior years. Our result also includes the settlement and legal fees associated with the conclusion of the legal proceeding mentioned above. INOVIQ made significant progress during the year, including the clinical validation of sub-B2M technology and the signing of a commercial partnership for its ExoNet technology. These milestones have significantly de-risked INOVIQ's core technologies and positioned the company to advance its multi-product exosome capture tool and precision diagnostics pipeline towards key development and commercial milestones in current fiscal year. We're confident that INOVIQ's disruptive sub-B2M and ExoNet technologies and high calibre team will enable us to achieve the ambitious goals that we've set for ourselves and make a significant impact on the lives of patients with cancer to the benefit of our shareholders. During the coming year, we expect our sub-B2M tests for breast and ovarian cancer to deliver key data by December 2023 and be launch ready for a clinical laboratory partner to supply as laboratory developed tests in calendar year 2024. We anticipate offering new ExoNet isolation products that will expand collaborations for development and novel exosome-based diagnostics for cancer, neurodegeneration and other diseases. This is my last AGM as Chair of INOVIQ, pending the results of our vote. I think this should be seen as being an extremely positive event. Our incoming chair, subject to pending resolutions, is a highly regarded person in the global financial markets who personally commits to companies with which he's involved. We are strongly of the belief that David will add great value to the company and that all shareholders will be rewarded by his involvement. In closing, I'd like to thank my fellow directors for their continued support and commitment over the past year, as we've navigated a broad range of opportunities and challenges together. I'd like to express my gratitude and that of the board to Leearne, the executive management team, and staff who have shown unwavering commitment and diligence in maintaining the momentum needed. Finally, I'd like to extend my appreciation to each of you, our shareholders, for your loyalty and support. I'll now ask David to formally introduce himself and say a few short words to the shareholders and the meeting.
Well, thank you, Geoff. Not sure how short it'll be, but I'm David Williams. I'm, for those of you who don't know me, an investment banker by profession, and I run a practice that does mainly M&A advice and capital raising advice. I'm also a large shareholder of the company. I think I'm the second largest shareholder of the company, so I've been sort of sniffing around it for some time. My background is really finance, so what can you expect from me? Well, I'll come to that in a moment, but I know Philip Powell and Max from a previous life, because Philip and I used to work together for a while, and then both of us, or the three of us, were on the board of Medical Developments International, which makes the green whistle, goes into all the ambulances in Australia, and the three of us are also on the board of PolyNovo, which makes the foam that goes to tissue repair. Mark, I know as well, of course, because he was CFO of Medical Developments for a time. And so we've got a little bit of history. And when Max, and how this came about was that when Max and Philip went on the board, they said to me, look, we think you can add something here. And those sort of requests became more and more intense over the last 2 years. And finally, I sort of relinquished over a very expensive dinner that they paid for. And so here I am here. But I think in terms of what I bring, my skills, in a sense, overlap Philip's, because he's got a very strong accounting and finance background. Mine is an accounting finance background, but it's more corporate and valuations and business strategy and M&A and so forth. That's my sort of forte. But my practice as an M&A advisor is really about 60-65% food and ag. So those of you who know me will know that we act for Coke and Cadbury and Bega and Vegemite and so forth. And the rest of it's really pharmaceuticals. So, we do work for China Grand, and you'll probably know that they've been very active in the last couple of years in the radiotherapy space, liver cancers and so on, so forth. So we've got quite a good practice in that. My strengths really are still M&A though, and capital raising. And so I think in terms of looking at me and what you might expect, if anything, from what I might contribute to the board comes out of my own personal philosophies and how I've sort of grown PolyNovo and how I've grown other businesses that I've been involved in, food and pharmaceuticals for that matter. And my first philosophical observation is that if you look at the Australian listed landscape, I did this just recently, but there's over 100 listed companies in this country with a market cap under $100 million, over 100. And, what I say is when I look at them, and we've done quite a few capital raisings in this last year for some of those, is that many of them are going to die. And they'll die in the next 6 months, maybe 12 months if they're lucky. And that's because they missed the boat on capital raising. And so many of them are not only low market cap, but they've got no cash. And so it's very depressing to think that a lot of those people are going to go broke. So my own personal philosophy is that the market will, if you think your science is good, the market will reward you if you raise more capital than you need and you really have a go at it. So crash or crash through is probably the wrong way to describe it. But I think, when I look at, say, what we did at PolyNovo, it had 6 employees. 2 of them were joint managing directors. Market cap was 20 mil, didn't have enough money, went out and raised 13 mil, share price doubled, raised some more money, share price doubled again, and now it's worth $1 billion. But that's because, in that case, we as a board decided, the tech really works. Let's start putting some people on before we even need them. we weren't manufacturing, didn't have a product in the market. Let's put on a manufacturing guy, let's put on a quality guy, let's put on a rig guy and get it going so that we're ready to hit the road when we need to. And so my first, when people come to see me as an advisor and they say, you know what, I want to raise $2 million, I want to raise $4 million, in my head, without even knowing the facts, I'm sort of doubling it and tripling it. If you tell me you need 2, I'm saying you need 8, without having done the appropriate due diligence. So, I think that now, does that apply to this company? Maybe, maybe not. Let's have a look. But that's certainly one of my key focuses is, making sure a company is properly capitalised, number one, so that it can have a good 2 years runway in terms of cash, but also making sure that you really have a go at making it work and not just die by 1,000 cuts, which is what the industry is largely contained with. It's worse, of course, in that listed space because in many of these biotechs, some of them are run by professors and scientists and so forth. And, one of the problems there is that a lot of these people don't want to let the IP go, so they hold on to the IP and they go, well, I don't want it in the public company, I'll lease it in and I want some of my professors as being on the board. Well, I'm not going to have any of that. So that's my philosophy is let's make this thing as commercial as possible. So that's one of my philosophies. So expect a bit of that. I think the other thing that comes out of that is when I look across that 100 plus companies that are undercapitalised and without enough cash, there's going to be a lot of M&A activity in this space over the next 6 to 12 months, because people are going to have to either go and raise money or they're going to go broke. And so I expect to see a lot of script for script acquisition work going on. And so I think we've got to sit back from this company, sit above it and say, okay, is this a diagnostics company or is it a therapeutics company? Would we get any more by having other diagnostic IP attached to it? Could we save some costs in terms of listing costs, which, for companies like us are probably $1 million a year? Grant Thornton, Sudsy here from Minda Ellison, it's like a human vacuum cleaner, really. But very, very, very good skills, I might say. But no, but we've got to really assess: are there things that we should be doing together with other people, and using our share price? Because I think we're all undercapitalised, and when your market cap's 20, 30, 40, $50 million, you can't do much. You haven't got any currency in your shares. So I think philosophically, we've got to look at the whole gamut and say, well, what should we be doing in the diagnostic space? And not only in terms of whether there's other people that make sense to us to be with, but also what should we be doing in the diagnostic space in terms of what we spend on CapEx. So, how much of this should we be doing ourselves? How much can we outsource and so forth? I don't have views on this, by the way. I'm just saying philosophically, this is what I think we need to do. And we've also got to have our eye on the prize of the therapeutic side of it as well. So where are we going to and how do we get ourselves ready for that? So that's my sort of philosophical view of life. My other philosophical view is that if you look at the boards that I've had, like Dassault, like PolyNovo, like Medical Development and so forth, the boards are what I'll call working boards. In other words, I don't want them to be management. I want the board to be able to help management and to be able to say, if you're going to do this in Germany, well, I'll just get out my Teledex, go talk to this guy because he's great. And so, if you look at, just by way of contrast, if you look at, say, PolyNovo, I've got a woman on the board who was in charge of all IP at CSIRO. I've got a woman on the board who was in charge of all manufacturing at CSL, just finished that $700 million factory out there. I've got, and so on and so forth. Got the ex-head of Johnson & Johnson and the ex-head of Smith & Nephew, I should say. So I want those people to be able to have the depth of management. And when you think about it, let's take, say, Robin Elliott from CSL. Here's a woman who gets paid a fortune at CSL to build massive projects all around the world, to do audits from 60 countries, and I'm paying her $60,000 a year as a director. It's cheap input to management. So this is really exciting to get the board right, so that the management team can get help when they need it. I'm building a factory at Port Melbourne, which is it's only cost me $10 million. So having the ability for Robin to call in on her way to CSL to finish off a $700 million project is fantastically powerful for the management team. So that's where I start from. I've just come with a different philosophy, and it may be that I've got nothing to add. Let's see, we'll have a bit of fun. And certainly, if we properly capitalise ourselves, we're not going to die wanting. We're going to know we're going to hit this hard and see if we can go harder again. And maybe we'll make something. Maybe I won't be here next year. Who knows? But you can be assured, given I've got roughly 5% of the stock, that we're all pointing in the same direction. So that's all I've got to say.
I'll now hand over to our CEO, Dr Leearne Hinch, who will provide an update on the company's progress and future plans. As mentioned previously, voting will remain open until the conclusion of the CEO presentation.
Hi everyone, thank you for attending today, and to those that are attending the meeting virtually. I'm Leearne Hinch, the CEO of INOVIQ. Right, sorry, I'm using a different computer to what we're using there. So INOVIQ is developing and commercialising next generation precision diagnostics and exosome solutions to improve the diagnosis and treatment of cancer. Our goal is to improve patient outcomes and save patients' lives. We're doing this using our disruptive sub-B2M and exonet technologies, which underpin our pipeline of cancer diagnostics and research tools. We've got compelling data for earlier and more accurate detection of both breast and ovarian cancers, and we've got 2 commercialised products in the market. One is our exonet research tool, and the other is our HTERT product for detection of bladder cancer. The way that we partner our products is to commercialise them with partners to enable them to be placed into the market globally. We ended our September quarter with $6.3 million, and you can see there that our 2 substantial holders are Merchant Funds Management and Moggs Creek Lawn Views. We can say represented by our new chairman. In terms of key achievements for the company, it's been a significant year for the company during the financial year and to date. We've made substantial progress across our key pipeline products, both for sub-B2M and exonet. Importantly, I just want to point out that the key areas is our... Does this have a pointer? Maybe not. Sorry, I'm missing... Right, the key areas that we want to focus on is that we clinically validated our sub-B2M test for breast cancer. That's incredibly important because it showed that we had significant sensitivity and specificity for detection of breast cancer, which really validated the technology across multiple cancers for the future. It then enabled us to enter a monitoring study for breast cancer, which is currently ongoing, that we expect to complete by the end of the year. That will enable us to partner this test and commercialise it as a laboratory-developed test next year. On the exonet side, importantly, we developed and validated and commissioned what we call a high-throughput exonet exosome isolation system. Now, the exosome isolation system enables us to deliver a whole range of services to potential partners, be they academic, biotechnology or pharmaceutical partners, to do exosome isolation at scale, biomarker discovery, and most important, diagnostic development. The result of that led to 2 partnerships. One is with Promega Corporation, which is a US-based company. That company essentially provides, it's a life sciences company, it's global, it's a private company, it's based in the US. It provides a whole range of life science reagents, tools and instruments to pharmaceutical companies and biotechnology companies around the world. Why are they excited about our product? They're excited because within their range, even though they've got about 4,000 products on the market, what they don't have is an exosome isolation tool. and they're competing with companies like Thermo Fisher Scientific and QIAGEN that do. So they needed a product that could isolate exosomes and that could be a marriage with their products that pull out what's inside the exosomes. So we provided that marriage, and we very much value that partnership. In fact, Greg Rice recently presented at a conference in the US, which was the Association for Molecular Pathology. It was a corporate-sponsored presentation by Promega. It was to a packed-out audience. It was basically a Pacific highly technical workshop, 60 seats. Every seat had a bum on it, and the back of the room was full of people. It resulted in a lot of questions in terms of follow-up to Greg, myself, to Promega, who had a stand, and also to our additional partner, which is ResearchDx, which is a contract research organisation, which we've also partnered with in order to provide services to pharmaceutical companies in the US. So we've really positioned our ExoNet technology now as a product for sale, as a service that we can earn contract research revenues for, and ultimately that we can partner with companies to develop diagnostics. So we're very excited by this technology. In terms of what does our business look like, we've got 3 key units for our business, and it's based on our different technologies. So our research tools and services business is underpinned by our ExoNet technology. That includes both sales of the ExoNet products themselves and ultimately our ExoNet services, where we'll earn the contract research revenues. Our current focus and future focus is very strongly on diagnostics. They're underpinned both, again, by the ExoNet technology and the sub-B2M technology. So we've got a number of diagnostics and also the original legacy product, which is our HTERT test for bladder cancer detection. In the longer term, based on the company's expertise and capabilities in exosomes, we have also developed a new technology which we call ExoAce, and that underpins therapeutic production of exosomes and ultimately an exosome therapeutics business. We'll talk more about that business next year. In terms of our pipeline, we have a rich pipeline of products, mostly focused around our exosome research tools and the diagnostics products that come from those research tools, and also our sub-B2M pipeline for both breast and ovarian cancer. So I'm going to cover off on exosomes first. As a reminder, what are exosomes? Simply, exosomes are vesicles that are released by all cells in the body. They can tell us about the health or disease status of a cell. We can capture those exosomes to see what's inside, which is the DNA, RNA, and proteins, which tell us about the health or disease status. That enables us to develop diagnostic tests for earlier detection of cancer, neurodegenerative diseases like Alzheimer's disease, and a whole range of other diseases. There's researchers doing all sorts of tests for cardiology, metabolic diseases, et cetera, There's enormous potential for both diagnostic and therapeutic use of exosomes. We are positioning ourselves as a leader in exosome science based on the high quality of our technologies that the company has and its expertise and capabilities that we have at our Melbourne facility and partners that we have in the US. The commercial potential of exosomes has been limited by the lack of scalable and efficient exosome isolation technologies. Effectively, we've solved that problem with our technologies. So we now have a fast, scalable, highly efficient and cost-effective technology, ExoNet, and also our ExoAce technology. And that actually is used for the exosome research market, is where we sell our ExoNet product and services. That's about a $600 million market globally. And ultimately, the prizes in exosome diagnostics and therapeutics, as you can see, that's an $8.7 billion market. So that's a high growth market that's based on 2029. So there's a lot of products in development now around exosomes. Certainly, the more companies we talk to, the more we're finding out how much research is going on in pharmaceutical companies around both diagnostics and therapeutics using exosomes. And all of them are struggling to find a suitable exosome isolation product that will enable these exosomes to produce at scale, also at high yield. And with diagnostics, what's important is that we can run them in commercial pathology labs. So we have developed ExoNet, which is an exosome isolation capture system based on magnetic bead that's got a matrix around it of different antibodies. Those antibodies enable us to pull out subsets of exosomes. The subsets that we pull out determine what type of diagnostic test we're developing. So our ExoNet product itself, we call a pan-exosome capture tool, meaning the antibodies pull out exosomes from all different areas of the body. That's the product we've currently commercialised. It's rapid, it's simple, it's cost effective. We can use it with downstream analysis, and that's where Promega comes in. So basically it's combined with Promega's extraction kits for RNA extraction, DNA extraction, protein extraction. At the moment, their focus is on RNA extraction, but they're building out their pipeline to provide further products to go with our ExoNet, which we're very excited about. Ultimately, we've shown now that this product is, we've proven the product is scalable, it's fully automatable. We run it on what's called a Kingfisher so that we can do 200,000 samples per year. That means that it can be ran in a commercial pathology laboratory, which is absolutely important to commercialise an exosome-based diagnostic. No one's been able to do that before. There is a exosome diagnostic on the market. It's actually for prostate cancer. That's currently ran as a laboratory-developed test. They're taking that through to IVD now. That's actually owned by a company called Biotechny. There's a second product, also a prostate cancer test, in actual fact, that uses an exosome isolation system that effectively, in our view, isn't compatible with high-throughput commercial laboratories. So there's some very large opportunities for us as a company and together with Promega to work with these companies to develop improved tests that will enable them to commercialise them as IVDs and run them in these high-throughput labs. Oh, did I go the wrong way? Nope. So in terms of what our exosome research tool and services business looks like, we have our exosome capture tools. As I said, they're partnered with Promega in a co-marketing agreement that enables us to provide a complete concept to market solution for exosome isolation and biomarker discovery. So we also provide a services business now. So we've basically upgraded our facility in Melbourne so we can provide customised ExoNet solutions for pharmaceutical companies. We can isolate the exosomes for them at scale. We can discover which biomarkers are of interest for certain disease types, and then we can develop the diagnostics. We have a further relationship with ResearchDx to provide that same service essentially in the US, but most importantly to take those diagnostics through to IVD approval with the FDA. That's really important, and talking to pharmaceutical companies over the last 12 months, that's one of the things we learned that was important to be a player in this market. We had to do two things. It was to set up a high-throughput exosome isolation system. We did that. And the second thing is to be able to provide that service and to be able to deliver it all the way through to market. And we can now do that with the partners that we have in place. Moving on to sub-B2M, I think Geoff carried this through pretty well when he presented earlier, so I won't go into a huge amount of detail, but just why are we interested in sub-B2M? What does it do? Essentially, what's called aberrant glycosylation, which means that cancer covers itself in a whole lot of sugars, and that is a hallmark of cancer. So what are we interested in detecting? We're interested in detecting a sugar called Nu5GC that in human beings in humans is only found in cancer. It's not found in healthy, normal cells. So what we've done is we have a protein that's been engineered to capture this particular sugar. We then used it to improve existing cancer biomarker tests. Many of the cancer biomarker tests can be elevated for reasons other than cancer, so for inflammatory reasons, for example. What we can do by using sub-B2M is now we're only detecting those cancer biomarkers, which are usually proteins that come from cancer only. So it improves the specificity of the test. The other thing that we've found over the last 12 months as we've developed this technology is it actually also improves the sensitivity markedly for early stage, so stages 1, 2, 3 and 4 cancers. And we believe that it's because, I'll just move over here, it's these little yellow, these are the sugars on the protein, and because there's multiple sugars on the protein, that enables us to improve the sensitivity of the test as well. that's very important because if we can improve by sensitivity and specificity, it opens up a whole range of opportunities. Our current focus is monitoring, but there is other possibilities for this technology for other purposes. Our first, or our key focus, our most advanced test is our sub-B2M CA15-3 test. That's for breast cancer monitoring. Breast cancer is the #1 cancer in women in the world. There's over 2.3 million new cases of breast cancer annually, and unfortunately, about 10% of breast cancer recurs. It can move up to 40% for triple-negative breast cancers. So one of the key opportunities for monitoring breast cancer is that these women need to be regularly monitored for breast cancer recurrence. And this is what we've developed this test for. The way that breast cancer is currently monitored is really through the recommendations, as an example, is that women need to be monitored 4 times annually for the first 2 years and then annually thereafter. How's that currently done? It's a combination of physical examination, clinical signs, and also imaging, and that can include mammography, but most importantly, a lot of clinicians use PET scans. They're very expensive, thousands of dollars per year, per test, and essentially it takes a day out of a woman's life to go and get this test done. It's extremely inconvenient, extremely expensive. So clinicians are looking for a test that's actually effective, that can be used very easily by a patient just going and getting a quick blood draw. So we've developed the sub-B2M CA15-3 test to improve on the existing test, which is, for example, Roche and Abbott produce, which is already approved for monitoring breast cancer treatment response and recurrence, but it's actually not very good in terms of sensitivity and specificity. What we've actually shown is that our test, compared to, this is actually the Roche test, we got 81% sensitivity and 93% specificity, and that compares to Roche's test of 37% sensitivity and 88% specificity. So frankly, it blew it out of the water. I will say it probably surprised us that the results were that good, and we're very impressed with our contract research partner that helped us to develop and validate this test in the US. So an outstanding result. On the bottom there, it really just shows that by stage of cancer. So on the left is stage 1, early stage cancer through to late stage. Again, we blew it out of the water. If we set specificity high at 95%, our sensitivity, they're the red bars, we outstripped the competitor test completely. So where are we at now? We're developing a breast cancer, we're taking the test into a monitoring study. It's a 2-phase study. It's in approximately 200 samples. We got those samples from Queensland Pathology. They had done a 10-year collection of breast cancer patients and monitored them over that period. So some patients have got 10 years worth of data, some patients have got 1 year worth of data. This has been an ongoing study. That's actually enabled us to basically run this study in 2 phases. The first component of the study, what we're looking to do is determine whether we call new CA15-3, which means the protein CA15-3 that's conjugated or linked to the sugar new 5GC. So let's just call it the new protein. We're looking to see whether it's equally expressed across the different subtypes of breast cancer. So that includes hormone receptor positive, HER2 positive, and triple-negative breast cancers. Then if we can show that they're essentially the same, that enables us to then move into the second phase of the study, where we will be monitoring those, be testing those patients across five time points pre-treatment and then four time points post-treatment. We'll compare our test to the existing Roche IVD test we're looking to show that we can detect breast cancer recurrence earlier than the Roche test. A very important outcome, and certainly from clinician feedback, there's a real need for a test that can actually detect recurrence earlier. The other test we have in development, again using the sub-B2M technology, is CA125. I won't go into any detail on this today. Essentially, it's a plug-and-play technology. I'll just actually go back a step. So this on the right-hand side here, what that actually shows is that this is an antibody. The antibody captures the protein. Normally there's a secondary antibody. That's what the current tests do. All we've had to do is swap out that secondary antibody with sub-B2M. Now, that's what makes it a simple, cost-effective test solution that has provided this increased sensitivity and specificity. What it means, though, is the difference between the CA15-3 test and the CA125 test is just we change that antibody. And so we just call it a plug-and-play technology. So that's why the ovarian cancer test development is so much faster than the test development for the CA15-3 test. So where are we at now in terms of this CA125 test? Is we're currently completing assay development and analytical validation. That will enable us next year to undergo clinical validation like we've already done for the breast cancer test and also a monitoring study for ovarian cancer. Importantly, when we partner the CA15-3 test, this test will have the same partner because it'll be a clinical lab like a Quest, a LabCorp or a Sonic Healthcare or other parties depending on who takes up the test. We have one other test which Geoff mentioned earlier. This is actually based on our exosome technology. So this is for earlier detection of ovarian cancer. What does that mean? We're really looking to detect early stage disease, so stages 1 and 2, as well as other stages of disease. This test is currently, we're seeking biomarkers from, sorry, not biomarkers, we're seeking samples from a range of different institutes at the moment in order to run a case-controlled clinical study next year. We have a couple of sources at the moment that we expect will enable that study to commence in next year, as I said. What is the go-to-market strategy for these tests? Essentially, what we're doing is we've built an analytical and clinical validation data package. The monitoring study that we're currently undergoing for the CA15-3 test completes that data package. That then enables us to provide that data to a clinical laboratory partner for assessment because we're seeking to commercialise the test first as a laboratory-developed test with a partner in the US. What that means is the partner needs to analytically validate the test in their lab. So we need to do a tech transfer. They need to do analytical validation. That could take up to 6 months for them to then be able to offer that test to market and earn revenues. The way we earn revenues from that is from the sale of our sub-B2M research use only kits to them to run the test in their laboratory so they can offer it as a service to clinicians. Ultimately, this test, we will seek to get what's called IVD approval. So that's where we get approval from the FDA in the US as a medical device. We would seek to do that somewhere over the next 12 to 24 month period. We'd move towards that following success in the markets. And then we'd look to expand this geographically into Europe, Australia and elsewhere. This just sort of shows how the test is actually performed. Essentially, a doctor would order the test. So it is a prescription-only product. It's not for an at-home use for a patient. You don't just buy the product off the shelf. So the doctor orders the test. The patient goes and gets a routine venipuncture. We then basically, in a laboratory, the serum's collected, the samples run on a standard autoanalyzer. So that could be a Cobas instrument, for example, which is in all commercial labs. It's a Roche instrument that runs its actual test. And then a sample report would be produced, and then the doctor would give the result back to the patient and determine what are the next steps for the patient in terms of follow-up diagnosis or treatment. I think the important thing to point out is that our sub-B2M tests are fully compatible with commercial pathology labs worldwide. In terms of the market potential, effectively, as I said, currently the total global market's about $4.2 billion. In terms of for monitoring, there's about the total market size for, if I look at the EU5, Australia and the US, we're looking at about 4.5 million tests per annum. So if, for example, the test was $150 a test, that equates to about a $670 million market for monitoring alone. So that the global market size includes screening, diagnosis, monitoring, and a range of other tests, and it does cover imaging. This is an untapped market, really, because the current CA15-3 test isn't really routinely used anymore by clinicians because its sensitivity and specificity is so low. So if we can actually, and we have today, improve on that test, this is a fantastic opportunity for the company. For ovarian cancer, the opportunity is quite different because the current CA125 test, although it's only approved for monitoring, it's actually used off-label for screening. And the reason it's used off-label for screening is there's absolutely nothing available at all for screening ovarian cancer. So at the moment, a patient will present with ovarian cancer late stage due to clinical symptoms. At that stage, a doctor will run a CA125 blood test, they'll do ultrasound, and then ultimately, if they determine the patient has ovarian cancer, they'll basically have to surgically remove the ovaries. At that stage is when they make an actual diagnosis of ovarian cancer. So the market really is a combination of monitoring and off-label use of the product. In terms of milestones coming up, we've already achieved a lot in this half, especially across our ExoNet products. And just putting that in perspective, we do all of our ExoNet research in our Melbourne facility in Australia. Our sub-B2M work is actually done with partners. So that includes ResearchDx as our contract research organisation, and also Nicoya, who's been doing an evaluation of sub-B2M as a potential SPR test. So everything for ExoNet is clearly on track. We've achieved an awful lot already across that, including a number of presentations at some key conferences. And we've got some important results coming up for our sub-B2M test, both analytical validation of the ovarian cancer test, the monitoring data for our breast cancer test, and also results from the feasibility for our SPR study with Nicoya. Moving into next year, it's really about commercial progress. So commercial progress of our sub-B2M tests, commercial progress of our ExoNet partnerships and sales. We also have a product that we have in development called NeuroNet. That's actually a different form of ExoNet that captures brain-derived exosomes. Again, due to our various discussions with pharmaceutical companies, this is a product they're very, very interested in because they need something to capture exosomes that come from the brain to enable them to be able to detect diseases like Alzheimer's earlier so that their treatments are more likely to be effective. So that's just what we're working on next year. It's really about execution, collaborations and partnering in order to be successful in the market as both as a diagnostics company, and then we'll have a few surprises on the therapeutic side as we move forward into the new year. So I think ultimately the company is extremely well positioned. It's been a very busy 12 months for the company, and now we're coming up to some exciting results around our sub-B2M tests and commercial results for ExoNet coming into the new year. Thank you. Questions?
Just one. What might an ExoNet commercial arrangement look like? Is there a precedent for a deal like?
So with ExoNet, there's a number of different ways we earn revenue from ExoNet. So one is through product sales. So that can be, for example, through an agreement with Promega. So Promega buys ExoNet to include in their kits basically for extracting the RNA and the DNA, which you can then sell to pharmaceutical companies. So it's sales of the ExoNet product. The other is providing research services. So we earn contract research fees. And then ultimately that leads to diagnostics development where we can earn licensing revenues from ExoNet. If that's the question about what does that look like, there's the way that would work is one sale of ExoNet for the final diagnostic kit, but also potential licensing revenue. So the way we've set up the sale of our research use only ExoNet is that's bought for research use only. If the product is used, if ExoNet is used in a commercial product, so a diagnostic, then they have to get a license off us. So they pay a percentage royalty on any test that would be developed using ExoNet.
question is, what might that percentage royalty be?
Very hard to say at this stage. Usually in the, let's say, the single-digit figures. But we're also selling ExoNet. So you sell ExoNet and then you get a single-digit royalty.
Just a question, David was talking about capital raise. You've obviously got multiple shots at goal that you mentioned in previous presentation. How soon do you anticipate the breast cancer test turning into a revenue stream? Because if you've got the best product in market, you growing a large and growing market, you expect that to be explosive growth in revenue. When do you anticipate something potentially happening?
In terms of revenue generation, we would expect that to be towards the end of next year. We do have to finalise an agreement with an actual lab partner. As I said, we need to tech transfer. They've got to analytically validate before they can actually provide the test to market. So it will take time to build revenues. Usually with laboratory developed tests, it takes a longer period to build those revenue streams because it's coming from a single laboratory. So as an example, if we partnered with a LabCorp, although LabCorp's got labs all around the US, we can only partner with a single lab as a laboratory developed test. To ultimately get the majority of your revenue, that's why you go to what you call an IVD medical device approval, because then we sell the kit and that can then go to any of LabCorp's laboratories around the US, as well as to other potential partners, depending on what type of deal we agree to. So it will take a while to build the revenues. It won't happen overnight, but certainly we expect, I mean, I've said what the market could be worth, but it will take time to build to that.
Second question, sub B2M, the plug and play that you referred to there. At this stage, is there any limit to the number of different cancers that this might be appropriate for?
The work done by our academic partner, collaboration partner, they've done a lot of initial work in breast, ovarian, prostate, some in lung, melanoma, pancreatic cancer. So there's a range of different cancers. So particularly solid tumours is probably an easy way to put it. So there's a range of different opportunities. There's current cancer biomarkers for all of those diseases. So we could essentially improve on those cancer biomarkers. Our focus at the moment, as you know, is breast and ovarian, but there are other opportunities and we'll look at those once we've commercialised these products.
But is there a realisation out in the wider community that you might have a science that is applicable across a broad range of cancers, do you think?
I think as we develop this, which has been our focus, is to get validation data for breast cancer, then ovarian cancer, and then we'll look at one other cancer which develops a package showing that really sub-B2M is a platform technology. That would then enable us to seek a different type of partner to a laboratory partner who might be interested in a platform to develop on their, let's say, existing instruments. That is what we are seeking to develop in the longer term with sub-B2M. Any other questions? Excellent.
Okay. Thanks, Leearne. Well, I think as a result of Leearne's presentation, you'd see that there's been a lot of work that's gone on over years that's built us to the point now where we have things that are on the cusp of commercialisation. With David coming on, if you look at his history and success in commercialising new technologies and seeing them develop rapidly and well, you'd see that you'd understand why internally we've got a sense that the stars are starting to align. So I think that the next 12 months will be an exciting period for us internally and for shareholders as well. So we look forward to it with great anticipation.